Insurance Group, insurance expert Adrienne Earle. Welcome.
Thanks. Happy to be here.
Yeah, good to see you. Were you at Jexpo already?
I was, yeah.
Well, give us a little update on what's going on over there.
Well, we had lunch, so that was good.
What was lunch?
Stoiana's.
Oh, yeah.
And we had tri-tip, shrimp, kind of like a taco bar, but elevated, and some peanut butter cheesecake in like phyllo dough. It was very good.
Sounds good.
Never seen it before. And Spring Arbor there, they put on the luncheon, and they said that it's the most booths that they've had in a long time. So
nice.
I think it was like 80 some vendors there.
Cool.
Yeah.
So you'll be back there this afternoon,
Yep, I'm
and
heading
you
back
will
after
be
this.
at the Walton Insurance Group booth.
Yeah.
Right.
Yep.
Now you got to scope out some of the booths. Did you see any that might be the winning display?
Ours.
Okay. Good answer. Yeah. All right, well, I'm going to come over later this afternoon.
Okay, awesome.
Great. Well, I know one thing that people are being bombarded with now are these ads for Medicare enrollment, Medicare open enrollment.
Yeah.
And for, I think anybody 65 and under, they just tune it out. But everyone else, they're paying attention, and it's mind-numbing. There's so much info.
Between that and the mail.
Yeah.
I mean, 7-8 pieces of mail a week. So it's a lot. And then people call in and they get confused and they think they have to make a change, or they're not sure what kind of change they have to make. And I mean, they don't have to make a change, but at Walton, Paula and I are always happy to take a look at what they have, determine if they're in the correct plan. People should have started to get their annual notice of change. So what that will show them is the changes that are being made in the plan that they're in. So if they're looking through that and they see maybe a prescription drug that they're on that has gone up significantly, they may want to give us a call to take a look at that and see if there's a better Part D plan for them.
Yeah, and that's one of the things too. These things can change really unbeknownst to you. Yesterday, the drug maker, I'm not sure, is it Pfizer, who makes Paxlovid, they secretly announced that the Paxlovid, the single regimen you take it for 5 days. If you get COVID, like right away you take it. It's been $560. Now it's going up to over $2,500.
Oh, wow.
Yeah.
Wow.
So if that's not in your plan, you're screwed.
Yeah, oh, for sure. Yeah. And a lot of times people will just get the annual notice of change and just think it's another piece of junk mail, and they put it to the side. Well, unfortunately, if you're out of that time frame in which you can make changes, you're stuck in that plan for a whole nother year.
Is there like a Rolls-Royce plan that covers everything?
I mean, there is on the Medicare supplement side, but as far as the prescription coverage goes, it really just depends on you specifically, what prescriptions you're on, what pharmacy you like to go to. So that really is going to change which plan is the best for you.
What is Medicare Advantage?
That is, it's similar to an employer-sponsored plan where you have a network. You have lots of extras, dental, vision, hearing is all built into the Medicare Advantage plan. It typically has an over-the-counter benefit, and a lot of the companies nowadays are really getting creative with the things that they're offering. So over-the-counter card benefit, healthy living, where you can get fruits and vegetables, a free gym membership. So a Medicare Advantage plan has all sorts of options. It's just you are tied to a network.
And are you paying more for it then?
No. Well, there's 51 different plans this year, and there are some $0 premium plans. But once again, it's going to be dependent on you, what doctor you want to see, what hospital you want to go to. If you want to go to U of M, there may be a plan that's better than if you wanted to go to Henry Ford. So it's really just very specific for the person.
And since we live in a community that our health system is Henry Ford, are there health plans that that Henry Ford doesn't participate in that we shouldn't even?
I don't think so.
No,
I don't think so. They're pretty good about participating with them all.
When people are healthy, it's not a big consideration. They're maybe not taking a lot of prescription drugs. They don't care. There's nothing that they have to worry about paying for if they're super healthy.
Correct.
But the minute, you know, that
Yeah.
changes,
Yeah. It's, you know, it's just like, you know, any kind of insurance. You know, you pay for it and you wish you had it when you actually need it. So it's always important to make sure that you have it in the event that you do need it.
are there any of these plans where you have to have to be evaluated, have to go through a medical exam?
There are instances where you do have to go through medical underwriting. If you don't choose, you know, a certain plan when you first age into Medicare, where you're guaranteed issue, if you decide, you know, you're like, I don't need it, I'm healthy, I don't really want to pay all those premiums, well, maybe 5 years down the road something happens and you want to get into that plan, well, you're going to have to go through medical underwriting, so you may not pass.
So everyone has the option to change plans, add or subtract or whatever during this open enrollment period.
Yes.
Should everyone that's in Medicare, should they do a reevaluation annually?
It's always a good idea to do it. Now, if your health has stayed the same, you're not on any new drugs, you got your annual notice of change and you notice that your prices aren't going to go up, then it may not be necessary to do an evaluation. But if you had some new medical history or you're on a new prescription or maybe you changed doctors or pharmacies, you probably would want to give us a call, and it's quick. We could just do it really quickly over the phone and say, no, you're good where you're at, or let's schedule a meeting. You want to come in and we can chat about it.
Nice, because you are and have Medicare experts at Walton.
Yes.
Before the show, we were talking about some of the advertising that we're seeing,
Yeah.
and there are some, I guess we wouldn't call them, you know, crooks, but their incentive is your money. They want to get you, and it just, some of the advertising is just, it's cheesy. And,
yeah. And that's kind of where we differ from some of the bigger nationals, is we really do care, you know, how it affects you. We're going to have to see you again. We hope that you would, you know, come back and see us. So we want to make sure that you really are in the best plan for you, the best cost, the best, you know, options as far as what hospitals you can go to. So we really do take a consultative approach to make sure that you are in the right plan.
I think if you are going to have an issue or have a question, if you sign up with someone that's in Long Beach, you're going to have a hard time.
Yeah.
You're not going to be able to.
No. I mean, I hate when I have to call somewhere and it's a roundabout, you know, and I have to push a million different buttons to get somebody. You call us and we handle it from there. And then if we need to have a call with you, we can do a conference call to the carrier. So it's really beneficial to work with somebody local, I feel. Yeah,
well, you can drive over and, you know, look them in their you know, eye and say, hey, you know. Yeah. Well, I agree. And I'm glad we have your agency and you with us here today.
Thank you.
So back to Jacksbo now, right?
Yes. Yep. Back to Jacksbo. And hoping, you know, for a good time. And looks like lots of people are going to be there today. I don't think that the rain is going to stop them.
No.
So
It's always raining on Jacksbo Day.
I know. I feel like it never fails. Whenever there's a big event, it's raining.
Yeah. Andy's planning to go over and go around with a plastic bag and collect as many pens as he can. Do you have pens at your booth?
I'll put some out.
Okay. All right. Thanks, Adrienne.
Yes, absolutely. Thanks for having me.
You bet. Adrienne Earle from the Walton Insurance Group, account executive and Medicare professional. A lot more. Still